This recording is over systemic lupus erythematosus. Systemic lupus erythematosus is a chronic progressive autoimmune disorder in which inflammatory and immune attacks occur against multiple self-tissues and organs. Chronic and progressive is telling us that the patient's going to continuously get worse. They're not going to return back to a baseline. Autoimmune tells us that it's the patient's own immune system, their own body, that's causing the problem with the disease. With lupus, tissue integrity is lost because of excessive inflammation and overactive immunity, leading to organ failure and death. Autoantibodies are the problem here, directed against many different proteins in the nucleus of the cells, and the circulating antibodies attack tissue. This causes a type 3 hypersensitivity reaction with the formation of immune complexes that precipitate and deposit in various tissues, resulting in some degree of impaired tissue integrity. This is type 3 hypersensitivity, if you remember, is also called immune complex reaction, immunocomplex reaction. The immune complexes sort of clumping together and depositing themselves in vessels cause systemic inflammation and attract other immune cells and products to the site, which can induce chronic tissue injury and destruction. Blood vessels are major targets, leading to chronic vessel inflammation known as vasculitis. And anytime those immune complexes sort of clump together and block blood vessels, that's going to decrease perfusion to our vital organs. Two big organs that are affected are the kidneys and the heart. Arthritis and joint pain are two other big symptoms that we see with lupus. Almost all patients with lupus have problems with arthritis and joint pain. We'll talk about some of the other signs and symptoms in a minute here. The exact cause of lupus isn't fully understood, but it's thought to be related to genetic, immunity, endocrine, and environmental factors. Triggers for the expression of lupus in a genetically susceptible adult include select viral infections, drugs, hormones such as estrogen-containing contraceptives and postmenopausal hormone replacement therapy, and exposure to environmental substances, especially ultraviolet rays and sun exposure. Lupus primarily affects women. Getting a diagnosis for lupus can be difficult because the signs and symptoms can be very mild and vague at first, and that can lead to delayed diagnoses for the patient. When getting a history on the patient, just remember that initial symptoms can be very vague, so we want to ask good questions to make sure we get as much information as possible from the patient. Want to ask about any sort of pain, generalized pain, any close relatives who have lupus or any other autoimmune disorders. If they notice any specific infection or if an environmental exposure occurred before the onset of symptoms. If they've had any unexplained intermittent fevers. What drugs are they taking? Certain drugs can cause lupus-like reactions, and we'd want to find that out. With your physical assessment, just remember that not all patients have all the signs and symptoms that we're going to talk about or that are included in the key features box in your textbook. Pain, arthralgias or muscle aches, rash, and inflammation are the most prominent initial symptoms noted. So those 4 symptoms are ones that you're going to want to keep the top of your mind when thinking about lupus: pain, arthralgias, rash, and inflammation, because those are the most common things we're going to see as initial symptoms. In terms of skin changes, the patient may have a dry, scaly, raised malar rash, also known as a butterfly rash. And you can see within your textbook, there's a picture of it where it goes over the woman's nose and then across her cheeks, sort of in the shape of a butterfly. That's a common symptom that you'll see in NCLEX style questions. So maybe you're doing just practice questions or whatnot. So you definitely want to associate a butterfly rash with lupus. Alopecia is another common finding, so loss of hair. Intermittent low-grade fevers occur. That's because of the chronic systemic inflammation. Chronic fatigue is common. It's not just a normal fatigue. It's a very extreme debilitating fatigue that the patient experiences. In terms of musculoskeletal changes, they're very common in patients with lupus. They include arthritis, arthralgias or muscle aches, muscle inflammation due to systemic inflammation, and hypoxia caused by vasculitis. Joints, we talked about joint pain is very common in lupus. Can be feet, ankles, knees, wrists, or fingers. An important thing is that it occurs bilaterally. So the patient wouldn't just come in and talk about their right ankle hurting. It would be both ankles hurting. Assess for painful red and swollen joints. Osteonecrosis can be seen in patients with lupus, osteo being bone, necrosis being death. So bone necrosis due from lack of oxygen because of the problems with perfusion. Some people with lupus have generalized muscle pain similar to fibromyalgia and sensitivity in tender points. In terms of kidney changes, we just want to know that because of the immune complexes that clump up, build up, and then block blood vessels, it can affect the function of the kidney, and it can alter how the kidney filters blood so that substances that normally don't filter through the kidney start to come through and be excreted in the urine, even though normally we don't see them because the kidney function is poor. One big thing that you can see being excreted in urine that normally isn't with poor kidney function is protein. So the filtering's abnormal and protein is getting out with the urine when it normally doesn't. Proteinuria is the name for that you want to be watching for. We want to look at urine for cloudiness, any blood, or the appearance of foam, which can be caused by protein in the urine. Cardiac changes occur because the immune complexes get deposited in different layers of the heart and its functional structures, including valves and cords. Chronic inflammation in cardiac tissue develops with the deposits, leading to pericarditis and valve thickening. Please review the box in your textbook for key features of lupus. The psychosocial responses to lupus can be extensive. This is a chronic progressive disorder that can have disfiguring changes and lead to significant organ damage, all of which can be very distressing for the patient. They may avoid social gatherings and family activities due to chronic fatigue, pain, and that can lead to anxiety and depression. Lupus cannot be diagnosed by one type of lab testing. Rather, multiple tests are performed and results are assessed to look at the findings as well as look at the client presentation to try and make a diagnosis. Blood tests are used to assess for the presence of autoantibodies, and that's going to be the main lab result that we're going to focus on for lupus. So under your lab table, there is one study there, test called ANA. That stands for anti-nuclear antibodies. And that's a big test that we'll see with our lupus patient that they're going to draw to see if that ANA is increased. If that ANA is increased, that's significant for the patient. It's not a definite diagnosis for lupus. An increased value means that there are autoantibodies present, but it's not just used for lupus. So it's not specific for lupus. It could indicate a different type of autoimmune disorder. But it's one of those tests that lets us know we're on the right path, that we know we're looking at an autoimmune disorder. You don't have to know this, is just an FYI, but over 90% of lupus patients will have that increased ANA lab value. So that's the one we're going to be focusing on now. So my patients' priority problems are going to be pain, fatigue, and the potential for organ failure due to chronic inflammation and or vasculitis. So in terms of treatment, for managing persistent pain, what are we going to do for the patient? Acetaminophen or NSAIDs can help with moderate daily joint and muscle pain. During periods of increased lupus activity or intense flares, corticosteroids can be used. Remember, those end in "sone" or "solone." Those are anti-inflammatory meds. which makes sense that we'd be using an anti-inflammatory med for this condition that's an autoimmune disorder causing lots of inflammation. Other treatments include getting proper rest and avoiding stressful situations that can cause a flare-up. Want to make sure that they know they can benefit from low impact activity to keep joints flexible while preventing cardiovascular complications. Sun exposure should be minimized. Remember that can trigger a flare-up, UV lights and sunlight. And patients should be taught to wear sunscreen and protective clothing. Moist heat can reduce muscle and joint pain, and warm baths and showers can be especially helpful. In terms of managing fatigue, remember the fatigue with lupus is going to be debilitating, so we want to advise the patient of ways they can conserve energy when doing what they need to do throughout the days. So we want to suggest that the patients make a list of activities they perform for home and recreation, and then identify what's a must, things that have to be done, which ones someone can help with, and which ones maybe aren't necessary. So it helps them prioritize their activities, because they might not be physically capable of doing everything they once did. Your textbook also has a nice box for avoiding fatigue associated with lupus, but the big thing is sort of planning your day and planning activities to allow for periods of rest to help deal with that extreme fatigue. In terms of preventing organ failure, drug therapy can be used. Corticosteroids such as prednisone, remember that ends in the S-O-N-E, letting us know it's a corticosteroid, are the cornerstone for lupus treatment. Steroids provide general anti-inflammatory immunosuppressant effects, which can be helpful for this disorder, again, because it's an autoimmune disorder that causes excess inflammation. Another category of meds that helps are anti-malarial drugs, such as hydroxychloroquine, which has immunomodulating and anti-clotting effects. I'm going to keep looking here. A major complication with anti-malarial drugs such as hydroxychloroquine is it can cause toxicity to retinal eyes and cause retinopathy. So we want to make sure the patient's getting frequent eye examinations and following up with an eye doctor. NSAIDs are also used. Examples of NSAIDs you should be familiar with: ibuprofen, of course, naproxen, celecoxib. They're used to treat pain and inflammation. Low-dose aspirin can be used to prevent clots. And we want to teach patients, if they're taking NSAIDs, that they can take it with food to prevent GI symptoms. Expect routine labs to monitor kidney functions. Immunosuppressives are another classification. Prototype drug you'd want to be familiar with is methotrexate as an immunosuppressive drug used to treat lupus. Immunosuppressive, just like it sounds, is going to suppress the patient's own immune system, since the problem is their immune system is attacking itself, causing problems. We're going to suppress the immune system so that they don't have so many signs and symptoms. Complication of that, though, we're turning down their immune system, so what's that going to put them at increased risk for? Increased risk for infection. A lot of NCLEX style questions for patients who are either taking corticosteroids or immunosuppressants, anything that's going to turn down the immune system. Though you'll have NCLEX style questions that are trying to assess, do you understand that they're at increased risk for infection? And the answer options may be that the patient's told to stay away from people who are sick, stay away from large gatherings, have good hand washing, those types of things. I want to tell the patient with or who is taking an immunosuppressive to report any fevers higher than 100. Another classification is monoclonal antibodies. They control many other autoimmune disorders. They block specific pro-inflammatory cytokines that stimulate immune attacks on self-tissue. A lot of these medications are going to end in MAB for monoclonal antibody. And under lifestyle changes, just always remind the patient to avoid sunlight and UV rays as much as possible, and make sure that the patient is discussing the health of their bone status with the provider, because we're worried about the osteonecrosis and bone issues in the patient with lupus.